Logan. Thank you for your research proposal on anxiety of falling among elderly population. To be honest with you, I haven't read anything about it. That's why I was interested in the subject because I haven't worked with elderly population and it didn't even occur to me about this anxiety of falling. Now I'm thinking that I have a father who's 75 and he fell last year, and since that fall he's been really anxious of walking again on his own. He's been in physical therapy and he's been having some collateral damage and some issues even from before, like lack of proper physical movements and also depression. The anxiety of falling among elderly population could really be beneficial, benefit from having CBT, because this cognitive behavioral therapy could treat elderly individuals in a level that they can understand in their head, like in their cortex, how these thoughts are really getting into their emotions and then into their behaviors and even their movements. There's a major issue, as you say, that could be from 3%, some cases, or 92% of anxiety in the individuals. And that's why I think that this type of research will really add to new literature and evidence-based research for to help our elders. The risk that you determine after 68 years of age or old, like lack of physical activity, depression, and other symptoms or other risk associated with this issue, definitely can be treated with CBT, because as you cite different types of research and literature, there's different evidence and enough research that are in a way having a foundation of this research. They agree that CBT will help with this situation for elders. How effective could it be, and why, and how could it happen? The experimental lab design that you propose, I think, is the right way to find it. The hypothesis, which is that if elderly individuals receive CBT, their anxiety of falling will decrease. It goes exactly with the objective, with the question that you are asking yourself, and due to the possibilities of control the independent variable in the experimental lab design, you could obtain uh, the right result in this case. It is important to counseling because we'll add alternatives to elders to reduce the anxiety of falling, and perhaps it will open other opportunities of research, other areas that elderly population are suffering from. When you talk about ASEA 4031, I think this research is also part of something that corresponds to a biblical foundation. As Christians, we are supposed to respect and honor everybody, but our elders. And definitely the promise of the Lord that when we wait in Him, when we wait for the Lord, He will give us new strength, is a hope for elders, a hope for everybody in reality, but it goes along with this research proposal. Thank you. I just learned something new, and I appreciate the way you presented, very well organized, very well done. Thank you.